Good afternoon, everyone. Thank you so much for joining us for NACo's third information session series focused on how you can use American Rescue Plan Act state and local fiscal recovery funds to address negative economic impacts and providing supportive services. You may remember previously we had done two other information session series, one that was completely focused on the U.S. Department of Treasury's final rule for the revenue replacement. And then our second one was all around using these funds for broadband infrastructure. So again, this is our third series. We are very excited for you to be joining us. Today, I am also joined by Rachel Mackey, who serves as the Associate Legislative Director for NACo's Human Services and Education portfolio. And I am Erin Hurley, the Deputy Director of Government Affairs here at NACo. So how this session is going to go is that I will just kind of provide a brief overview of some of the key takeaways of the U.S. Department of Treasury's final rule for the $65 billion fiscal recovery fund. And then I will kick it over to Rachel, where she will do a deep dive into those eligible uses around addressing the negative economic impacts and providing supportive services. So first and foremost, some of the key highlights when we're talking about the Department of Treasury's final rule. So first and foremost, what Treasury states in the final rule is that the final rule does not actually become effective until April 1st of 2022. However, counties do have the option to opt in for the final rule, take advantage of its broad flexibility. However, you are not required to do that. You also have the option of continuing to operate under the interim final rule until that April 1st date. So it's really up to your county's discretion. Another key takeaway, which is very, very significant and a huge priority that NACo really aggressively advocated for the inclusion of in the final rule, is that now counties can allocate up to $10 million of ARP recovery funds towards lost revenue. What Treasury refers to it as is that it is a standard allowance. So you can allocate up to $10 million of your ARP allocation towards lost revenue and then use it on any sort of government service that your government would traditionally provide. And you can do this without actually calculating your revenue loss. Also regarding the revenue loss category, this is kind of a little bit different than that $10 million standard allowance. But for those counties that are continuing to choose to actually calculate your revenue loss with Treasury's updated formula, there were some changes in regards to that formula that you were previously using. First and foremost is that you are allowed to actually include additional revenue streams in contrast to those included under the interim final rule. Namely, you can now include revenue from utilities as well as liquor store sales revenue. And then I'll go into more detail on this in just a second, but the Treasury Department also did change the default growth rate for you to use in that revenue loss formula as well. For capital expenditures, this was we received a number of questions from counties while they were operating under the interim final rule, but the final rule does clarify what are the allowable uses in terms of capital expenditures. And Rachel will go through a long list of how you can use your recovery funds to invest in capital expenditures, those capital infrastructure projects that support your communities and residents. Number 5, and the next key highlight is all around the fact that the final rule presumes that some populations were impacted or disproportionately impacted. Again, Rachel will go into more detail about this, but what it really does in sum is that it allows you to provide more aid, support to a larger amount of your residents. In terms of premium pay, what the final rule does is that not only does it identify additional employees that are eligible to receive premium pay, but it also streamlines the process in terms of actually administering premium pay to employees. In terms of rehiring local government staff, you may remember under the interim final rule, you were allowed to rehire to your pre-pandemic levels. So whatever your local government employee level was, January 27th of 2020. So you are still allowed to do that under the final rule, but now you can actually rehire above your pre-pandemic baseline. So up to 77.5% above what your number of employees was on January 27th of 2020. In terms of broadband infrastructure, now you are allowed to use any recovery funds for the modernization of cybersecurity. Under the interim final rule, you were only allowed to use your revenue replacement dollars. But now under the final rule, you can use any of the dollars even outside of that revenue loss category. For water and sewer projects, under the interim final rule, what Treasury did is that they stated that eligible projects to invest in for water and sewer were the same as those of the Environmental Protection Agency's Drinking Water State Revolving Fund and Clean Water State Revolving Fund. So under the final rule, Treasury just broadened the eligibility of these projects to include, just to name a few, culvert repair, dam and reservoir rehabilitation, and then a broad range of lead remediation projects as well. And then finally, kind of going back, pivoting back to the broadband infrastructure, also there, what Treasury did is that it just broadened some of the projects, the broadband projects that you are now allowed to invest in and can reach additional homes and small businesses. So soon, actually the day after, Treasury released their final rule on January 6th. On January 7th, they also released the project and expenditure report and user guide. So this deadline is actually coming up fairly quickly on next Monday, but there are a handful of counties that will be required to submit their first project and expenditure report to the Department of Treasury on January 31st of 2022. So again, that's next Monday. The only counties that are required to submit that first project and expenditure report are counties that have populations above 250,000 residents, and then also counties that have a population below 250,000 residents, but received more than $10 million in your total recovery fund allocation. So when you are submitting that report, you will be required to report on how you've either obligated or spent the dollars between March 3rd of 2021 to December 31st of 2021. And then finally, for those counties that are not either in that tier 1 or tier 2, as outlined by Treasury, again, population threshold or amount of funds that you received, your first project and expenditures report is not due until April 30th of 2022. So you just can hold off for the time being. You actually don't have a report to fill out quite yet. I will also note, in terms of the projects and expenditures reports, we have heard from several counties about some issues that they've come into contact with regarding the portal. NACo is in communication with Treasury about those difficulties right now, and we will of course keep everyone updated as we are able to solve those challenges. So just as a quick refresher for folks that are joining us today, you are still allowed to invest in kind of 6 key areas when we're talking about the recovery fund. So of course, supporting the public health response, addressing negative economic impacts, which of course we're talking about today, replacing lost revenue, providing premium pay to essential workers, and then of course, investing in both water and sewer infrastructure as well as broadband infrastructure. So in terms of decoding the language of the final rule, and Rachel and I just wanted to point this out at the top of this presentation because these words are used especially throughout the negative economic impact section. So you'll see a lot of shoulds and musts throughout the final rule. So just remember that those are pretty much equated to mandatory reporting and compliance in terms of how you can use the funds. You also see a lot of may and encourage. So this is really more county discretion, just more so of federal preference in terms of how you're investing the money, but it's not mandatory. And then proportional and reasonable. And this is very important, especially for the negative economic impacts and support services section within the final rule, because whatever amount of funds that you are investing in that ultimately will be used to address negative economic impacts, it has to be proportional to the negative economic impact experienced by an individual, a household, family, and so on. So really quickly, I'm just going to go through one section of the final rule before passing it off to Rachel. We have received the most questions regarding the updated revenue loss or revenue replacement section. So just want to go through what those key new features are and how it impacts the recovery fund. So first key new feature, and I mentioned this at the top of this session, is that there is a new $10 million revenue loss allowance. So again, now counties have the ability to allocate up to $10 million of their total recovery fund allocation to spend it on government services. If you choose this option, you are not required to use the Department of Treasury's revenue loss calculation. Simply, you can just opt within the report, the project and expenditures report, saying that this is the route that you would like to go in. Under this new provision, as you'll see on the screen, there are 2,137,000 counties that can now allocate funds completely towards this revenue loss option. So that's 70% of the nation's counties that are eligible to invest the entirety of your allocated recovery funds. The second key new feature, outside of your ability to allocate your funds towards this new standard allowance, is that there are improvements to the revenue loss formula that Treasury created. So as I mentioned earlier, there's an updated definition of general revenue in terms of you being able to now include utility revenue and liquor store sale revenue in your revenue loss calculation. Also, you are allowed to choose to calculate your revenue loss on either a fiscal year or calendar year basis. You may remember under the interim final rule that counties were required to calculate their revenue loss at 4 different points in time, which included December 31st of 2020, 2021, 2022, and 2023. So now under the final rule, you have the option to either calculate again on the fiscal year or calendar year basis. Whichever option that you do end up choosing, you do have to stick with it throughout the duration of the program though. And then finally, that revenue loss growth rate change. Under the interim final rule, what you had to do is calculate your county's average revenue growth over the last 3 fiscal years prior to the pandemic. So you take that percentage, you originally compared it to a 4.1% growth rate, which is that Treasury used 4.1% from data that was readily available. Under the final rule, what they did is actually increase that percentage to 5.2%. So you still go about calculating your average annual revenue growth from those 3 fiscal years, whatever percentage it was, you choose either between that percentage or the 5.2% now, whichever is higher of the two. Then after you do calculate your revenue loss, again, either the $10 million standard allowance or continue using the revenue loss formula, you can use those funds towards any sort of government service that's traditionally provided by a government. So Treasury does outline some common examples of what they mean when they're talking about government services. However, I do want to stress that these are just examples in terms of guiding. But again, you can really use the funds for any sort of government service that your county would traditionally provide. And really the biggest limitations around those is that you just simply cannot use your revenue loss funds for rainy day funds or debt service, as well as a couple of other ones that I'll get onto in the next slide. But again, as you can see on the left side of the screen, just some really good examples of how you can invest these funds, but you are not limited to investing the dollars just in these handful of activities. So key takeaways in terms of the revenue loss, again, you now have 2 options to calculate your revenue replacement, either the $10 million standard allowance. The second is continuing to calculate your revenue loss. If your county had previously declared your revenue loss as $0 in that first interim report that you submitted to Treasury, either August 31st of 2021 or 60 days after you certified for the funds, you will be allowed to update this number on your first project and expenditures report. And then finally, just as a reminder, even when you are using if you decide to allocate funds towards this revenue loss piece, you are still required to comply with the reporting requirements set forth by the Department of Treasury, as well as the uniform guidance too. And finally, before I kick it over to Rachel, these are the ineligible ways that you cannot use the recovery funds. So you still cannot use the recovery funds or the revenue replacement for extraordinary contributions to a pension fund. You can't use it for debt service, as I mentioned earlier, either a rainy day or reserve account. You also can't use the funds for settlement agreement, judgment, consent decree, or judicially confirmed debt. And then finally, the last two are somewhat new, or the final rule does provide clarity on it, is that you can't use the funds that conflict with the purpose of the American Rescue Plan Act statute. So what this means, you can't use the funds that conflict with COVID-19 mitigation practices or any sort of CDC guidance that's been released. And then you also can't use the funds in any sort of violation in terms of the uniform guidance. So that was just a quick overview of some of the key highlights, but now I will kick it over to Rachel to talk through the negative economic impact section.
Thanks, Erin. And I did want to say that we had a question about revenue loss and being able to use it for programs to give funds to small businesses and nonprofits. So would that be eligible?
Yes, that would be eligible.
Great. So as Erin said, I'm our human services and education lobbyist here. And so my committee has really been focused on how these funds can be used to support vulnerable county residents. I see a question about childcare in the chat. That's been a big focus of our committee, and we'll dig into all of that. So today we'll be touching on the eligible uses for negative economic impacts and what that looks like in the final rule. I'm going to really hone in on some of the assistance to households and nonprofits, but I will just say, off the bat, that some of the things we'll talk about, like social service organizations or childcare, there's obviously things in premium pay and other aspects of the final rule, like public sector capacity, that can also touch on these functions, for instance, improving your social service staff. But we're going to focus a little bit more on services to county residents in particular during this session. So the major thing that the final rule does with respect to the interim final rule is it really broadens the population that is considered to be impacted by the pandemic by creating two categories: households and communities that are impacted by the pandemic and those that are disproportionately impacted by the pandemic. You'll all recall that disproportionate impact was a really big factor in the interim final rule in determining certain services. That's still true, but the impacted population has really been broadened, and there's a wider range of eligible services that you can provide those folks as well. So the kind of general takeaway is that you can provide even more services to even more vulnerable people in your counties under the final rule. So in terms of defining impacted households, Treasury is basically blanket presuming that the following households and communities were impacted by the pandemic with respect to negative economic impacts. That's lower moderate income households and communities, but also households that experienced unemployment, food or housing insecurity, households that qualify for other federal assistance programs, such as the Children's Health Insurance Program or CHIP, childcare subsidies under the Child Care and Development Fund, or the Child Care Development Block Grant, as you may know it, or Medicaid. And then also just for affordable housing programs, impacted households include those that qualify for the National Housing Trust Fund. And just for services that address lost instructional time, any student that lost access to in-person education is also considered impacted by the pandemic. Disproportionate impact, on the other hand, is a little bit more narrowly defined to just low-income households and communities, so taking that moderate income out of the equation, as well as households residing in qualified census tracts, which is a carryover from the interim final rule and has to do with the percentage of a census tract living under a certain income level, as well as households that qualify for other federal benefits, including the Temporary Assistance for Needy Families Program, the Supplemental Nutrition Assistance Program, the Supplemental Security Income Program, WIC, which is the Special Nutrition Program for Women, Infants, and Children, Section 8 housing vouchers, as well as the Low Income Home Energy Assistance Program. So just a wide range of federal programs that essentially confer disproportionate impact status onto participants, as well as households receiving services provided by tribal governments. And just digging in a little bit further, because the definition of low income and moderate income can vary based on where you are, Treasury is also clarifying here what they would consider to be low or moderate income. So in the lower moderate income category, which again refers to that impacted population, anyone who earns at or below 300% of the federal poverty guidelines would qualify. There's also the metric of income at or below 65% of the area median income for the county. And it's important to note that counties can really just presume any household earning less than $65,880 in a year is impacted and eligible for services. Additionally, while you're encouraged to look at individual household sizes when determining whether someone's low or moderate income, if you're doing a project like building a park, for instance, where it might be easier to just kind of look at the community, you can assume a household size of 3 to just sort of default at your comparison of, whether the median income of the neighborhood is more or less than what the federal poverty guidelines are for a household that's got 3 people in it. And there's also broad flexibility. Counties can designate additional households as impacted or disproportionately impacted. So while these are all kind of easy, streamlined metrics that you can use, that's not to say that you couldn't potentially justify serving another population as impacted or disproportionately impacted. For that low income and disproportionately impacted group, we're looking at a slightly lower income level at or below 185% of the federal poverty guidelines, or at or below 40% of area median income. But that rule of being able to use a default size of 3 when sort of assessing a broader sort of community level or household level income still holds. And you can just assume that anyone earning less than $40,626 a year is disproportionately impacted. For those of you who might not be as familiar with the federal poverty guidelines that are referenced before, these are the federal poverty guidelines for 2022. They're determined by the Department of Health and Human Services. They vary based on whether you're in the contiguous US or in Alaska or Hawaii, since cost of living is so much higher in Alaska and Hawaii. So just because we spoke about that threshold of a household size of 3, just would flag that the poverty level for a household of 3 is considered to be $23,030 annually. So now that we know how we're defining impacted and disproportionately impacted households, what can you provide them with? The answer is a whole lot. And I guess, again, this list is not exhaustive. So it's really just examples of the types of services that you can think about providing. For impacted households, so again, those are those low and moderate income households. And, a couple slides back, we define who qualifies for this. It would be food assistance and support to food banks, emergency housing assistance, health insurance coverage expansion, benefits for surviving family members who died from COVID-19, burials and home repair and home weatherization, cash assistance, which I'll note should also be governed by that proportionate rule. So, if a household lost a certain amount of income or experienced, a reduction in working hours or something else because of the pandemic, you should really only be providing them with cash commensurate to that amount within reason. There's also still the eligibility to provide assistance in accessing and applying for public benefits or services. But one thing I will flag is that before, in the interim final rule, childcare and early learning services and home visiting and some other really specific services were relegated to disproportionately impacted communities. And those have really been broadened and opened up now to impacted households more generally. Same goes with assistance for learning loss, for K-12 students, services to foster youth. All of these services now are pretty much eligible within this broader category of impacted households. So that should make things a little simpler as you're thinking about targeting different households and communities in your county with these types of recovery fund eligible uses. That said, the disproportionately impacted households do have their own sort of next level of eligible services. And that includes paying for community health workers to help households access health and social services, remediation of lead paint or other lead hazards, whether in household or perhaps in a childcare facility or another place. primary care clinics and hospitals and the integration of health services into other settings, housing vouchers and assistance relocating to neighborhoods with higher economic opportunity, investments in neighborhoods to promote improved outcomes, improvements to vacant and abandoned properties, and again, services to address educational disparities, as well as school and other educational equipment and facilities. Alongside those sort of household and community level services, the negative economic impact section also continues to allow you to provide assistance to small businesses. There's a whole list here of how to define impact to a small business. And that includes decreased revenue or gross receipts, financial insecurity, increased operational costs, capacity to weather financial hardship, challenges covering payroll, rent or mortgage, and other operating costs, and other reasonable factors determined by the county. And Treasury is considering small businesses to be those with no more than 500 employees and independently owned and operated. The reason that I include this is, again, many of you have asked about childcare, and I think that aid to small businesses most definitely also allows for you to make grants or provide assistance to childcare providers. This small business just has to be operating in a qualified census tract if it's disproportionately impacted. Or there's some other factors there, but either way, those are both eligible for assistance. Additionally, you can provide loans or grants to mitigate financial hardship, technical assistance and counseling. There's a whole Treasury guidance section on loans that we won't dig into here, but that's certainly possible. And for those disproportionately impacted small businesses, you can also help with rehabilitation of commercial properties, technical assistance, business incubators and grants for startup or expansion costs for small businesses. And again, support for micro businesses, which can include financial, childcare, and transportation costs. You can also continue to provide assistance to impacted and disproportionately impacted nonprofits. And, that's really important because many of you work with nonprofits to provide services to vulnerable residents in your counties. And nonprofits have also had trouble keeping their doors open. So can really target that assistance to 501c3 organizations. Those same sort of impacts and disproportionate impacts as small businesses sort of apply here. I will say that the final rule did add 501c19 tax exempt organizations to the eligible nonprofits. Those are organizations that exclusively serve veterans. So, if you have an American Legion or a VFW or a similar organization in your county, you now have been given sort of explicit permission to provide assistance to them as well. And again, eligible uses can look like loans or grants or technical or in-kind assistance, just anything that helps mitigate those negative economic impacts of the pandemic. And of course, there's also aid to impacted industries. So this is another one where, childcare could really benefit from this definition because the final rule gives some clarity around what is considered to be an impacted industry. It includes travel, tourism, or hospitality sectors, but there are also mechanisms to determine disproportionate impact by comparing them to the travel and tourism and hospitality sectors, or if that industry experienced at least 8% employment loss from pre-pandemic levels. The childcare workforce lost about 200,000 workers between 2019 and 2020. So, assume it would qualify. Counties really have flexibility to define industries, but it's important to note that that aid can only be provided to businesses and attractions that were operating prior to the pandemic and were affected by required closures. So I'm going to let Erin talk a little bit more about capital expenditures, but I do want to just add that, I had conversations with a lot of you during the interim final rule about whether or not things like a new school building or a childcare facility would be eligible as a capital expenditure. And our answer was, we're not really sure. Our answer now is yes. Those things are eligible. There are some caveats and some additional instructions that go along with capital expenditures that I'll let Erin dig into, but this is another example of where things have really been broadened out to kind of expand the flexibility with which you can use these funds to serve vulnerable populations in your counties. So I'll kick it back to Erin to talk a little more about that.
Great. Thank you, Rachel. So building off of what Rachel just said, and what I mentioned when I was going over the key highlights. So you can use recovery funds for capital expenditures. There are a few reminders for folks that are planning to invest their money in this way. So first is that whatever capital expenditure you are investing in, it has to be proportional to the impact. And again, it has to be either related to the public health response or negative economic impacts. And then in terms of depending on how much your project costs, so it's a threshold between if it's either equal to or greater than $1 million and then above $10 million, you are required to provide a written justification to the U.S. Department of Treasury. So on this side, you can see here what will be required of you depending on how much your project costs. When I'm talking about a written justification for your project, really there are three key items that you will have to provide, or key points of information that you will have to provide. So first, you have to describe the harm or impact that you are using the capital expenditure to address, and what is the projected outcome. For example, it will benefit 100 individuals if you invest in this capital expenditure. You also have to demonstrate as to why this new project that you're undertaking it needs to happen, and that your current county resources are inadequate to address that harm or need. And then finally, the last point is as well too, is that you have to provide two alternative scenarios to address the harm or need, and why your capital expenditure is the superior option. So those are the three key points that you have to include in your written justification to Treasury. This slide right here pretty much just shows when it really is needed. So if your capital expenditure is less than $1 million, there is no written justification needed for Treasury. If it's either greater than or equal to $1 million, but less than $10 million, and it is clearly outlined as an eligible use under Treasury's final rule, you will need to write a written justification, but it doesn't necessarily need to be submitted as part of reporting. However, if it's beyond the eligible uses that have been outlined by Treasury in the final rule, you will both need to write a written justification and submit it as part of your reporting. And then if your project is $10 million and above, no matter what, you will need to provide that written justification and submit it as part of your reporting to the Department of Treasury as well. So there are some additional requirements in regards to capital expenditures. And then this slide here simply, and Rachel, feel free to speak more to this slide. I will just specifically highlight the ineligible capital expenditures on this. So you can see on the right side of the screen, Treasury clearly outlines that construction of new correctional facilities, construction of new congregate facilities, and construction of convention centers, stadiums, or other larger capital projects is an ineligible expense. That last one regarding convention centers and stadiums, I do want to focus on the general economic development piece of that. This is because Treasury is stating that the recovery fund itself was set up to address negative economic impacts. So if you're investing funds that, that kind of go towards more general economic development, that kind of deviates from the original intent of the recovery fund. So that's why they decided that was an ineligible expense as well too. But I'll kick it back over to Rachel to talk about the eligible projects.
Yeah, and the eligible capital expenditure projects, again, these are just examples, and they include things like medical facilities generally dedicated to COVID-19 treatment and mitigation, and some other sort of COVID related uses. But again, when it comes to say improving or constructing new childcare facilities to say increase the supply of childcare, or building a new school, or improving or rehabbing a school, perhaps even beyond sort of the HVAC and air quality measures that were outlined in the interim final rule, as well as behavioral health facilities and affordable housing and permanent supportive housing. A lot of you were also really interested in permanent supportive housing for those who are homeless and in need of wraparound services as a result of the pandemic. So those are all eligible as long as, again, you're following sort of the different parameters that Erin just outlined. So a lot of broad flexibility here. So just wanted to dig into a few county examples before we answer questions. And, we'll just add that our recovery fund database is such a great tool, really great examples across the board of how counties are spending their money. And you can find that on our website. But just wanted to pull out a few examples of how counties are addressing negative economic impacts with their recovery funds. So King County, Washington, these are just a few examples. Obviously people are doing way more than what we're saying here, but just wanted to pull out a few. So they're spending $4.5 million on a rapid response to homelessness that's based on a housing first model. And that includes non-congregate temporary housing with the provision of wraparound services, as well as street outreach to those who are homeless. They're also partnering with a community-based organization. I actually believe it's a United Way, to provide $5 million worth of food security assistance to around 6,600 households. And they're also planning to make really significant investments in childcare, including grants to providers, both those formally licensed businesses as well as informal providers, and to continue supporting a childcare voucher program that they created to help essential workers access childcare during non-traditional hours, or if they earn too much for the traditional federal subsidy. There's also Collier County, Florida, I hope I said that right, which is going to invest $5.1 million in food programs, including supporting some food banks, but also giving food security goods and services directly to households. They're also spending $7.5 million on rental and mortgage assistance in the form of direct grants to households, as well as an investment in eviction prevention through housing navigator services, which will connect folks with lawyers and other providers who can kind of help them navigate the eviction process and provide some legal aid. They're also allocating $1.5 million to nonprofits serving socially vulnerable individuals and investing in educational sessions at their libraries in high poverty school districts with programming focused on community outreach and homework centers and teen life skills. And finally, there's Buncombe County, North Carolina. They are constructing new units of affordable rental housing, and they're going to target that to those earning between 30 and 80% of the area median income. All of those units will accept Section 8 housing vouchers. So that'll be a really interesting project to watch. They're also providing about $1 million for services to survivors of domestic violence and sexual assault and human trafficking to ensure that they have continued access to the continuum of services they need and aren't disrupted by the pandemic. They're also allocating $500,000 to provide extended time at the Early Head Start Center in the day so that the young children in the program can stay longer and their caregivers can therefore seek employment or enroll in a complete degree or certificate programs, or run errands as parents need to do when their kids are in early learning. So those are just a few examples. And again, you can go to our website and filter both for human services as well as for children and families, as well as many other categories of expenditure to learn about what your peers are doing. And, at our upcoming legislative conference, this will certainly be a focus of discussion, I think, across the policy steering committee meetings and workshops. You'll get to hear from other counties on what they're doing in this area. And we'll certainly be discussing that at my Human Services and Education Policy Steering Committee meeting too.
Great. Well, that is the kind of deep dive into the negative economic impact section, and all of that related to the fiscal recovery fund. So now what we will do is we will kind of bring up some questions and talk through some of those key items here.
One question that I see here is about how jurisdictions are measuring food insecurity. And just wanted to elaborate on that a little bit. So, food insecurity is something that is typically measured through a survey that the Census Bureau administers. So I would imagine that, you can either rely on current data through USDA or through, say, Census has been doing like these monthly pulse surveys or had been doing that to kind of take a look at perhaps how food insecurity rates might have changed in your community. But you can also probably have people take that survey and flag whether or not they've experienced increased food insecurity. Again, that is something that allows a population to be considered impacted, but there's also plenty of other metrics that you can use if it's too much labor to determine whether folks experience food insecurity. You could look at their income, you could look at their participation in other programs, but would generally go off of what USDA uses to measure food insecurity and census in their survey materials. Another fund was about whether the funds could be used to reopen a Communities That Care office. And I'm not familiar with Communities That Care, but it looks like it's sort of a youth prevention system. So that certainly seems like something that would be eligible, again, as long as you can show that there is an impact either in the community that they serve, or if they had to close their doors because of the pandemic, for instance.
Mm-hmm. Great, thank you, Rachel. Another question that we received from Kevin O'Malley, the question is, can these funds be used to upgrade network infrastructure, all of which support county services? So in short, yes, you can use the recovery funds for that. It's actually explicitly stated in the final rule that you can use the funds to improve the infrastructure that's needed to ensure the efficiency and effectiveness of federal public assistance programs specifically. Also, the final rule does outline additional eligible expenses. This question alludes to some specific issues that they're having with servers, routers, switches, etc. And the final rule does outline how you can spend those dollars in that way too. But again, I think kind of the main point here is that if it does improve the efficiency and effectiveness of these public assistance programs, that would be an eligible expense too. And Rachel, if you have more to add to that, feel free to jump in.
No, I think that's spot on. And I think in particular, we know that, remote human service provision requires a lot of technological improvement. So I think, just in general, that would certainly qualify.
And then we have another question from Marcus Williams asking about the definition of a new facility. So this is in regards to the capital expenditures versus an improvements to an existing facility. So really what it is while it isn't necessarily defined explicitly in the final rule, simply if it is a new facility that you are taking on, that is how it's defined as. So something that hasn't necessarily been standing before that. And then improvements. So for example, if you are adding on a new wing to your hospital or a jail, etc., that would be more so of an expansion of a current building or facility.
We also got another question about whether capital expenditures to a nonprofit to provide a childcare facility to help low-income residents would be an allowable use. Again, I think that would qualify as a yes, as long as it follows those parameters for capital expenditures that Erin laid out before.
Definitely. And then One other, this is not regarding the negative economic impacts, but we'll get back to that in just a second. We just received another question, and it's one that we've received a lot from. The question is, do you have to declare the 10 million election on January 31st of 2022? That is something that we're working actively to receive an answer from Treasury on, whether you can defer that decision to a subsequent project and expenditure report. So when your next quarterly report is due. So again, we'll keep everyone updated with those answers from Treasury on that. But please know that we are working with them actively to receive a response from them.
We also got a question about whether constructing a medical examiner facility would qualify as responding to the public health emergency or its negative economic impacts. I think you could probably make the case for either, but certainly I would think the public health emergency would be kind of my instinct there, but I'm not sure if you have thoughts, Erin.
So that is a great question. So I think this kind of goes back to the explicitly outlined eligible uses when we're talking about capital expenditures. So as Rachel mentioned earlier, medical facilities generally dedicated to addressing the impacts of COVID-19, temporary medical facilities as well too. So while those are of course different, I think ultimately what we can do on our end is relay that question to the Department of Treasury just to receive confirmation, because that is a direct response to the impacts of COVID-19.
Right.
But just since it's not explicitly listed out in the final rule, do not want to speak too soon on that. Yeah. So I think maybe we have time for one or two more questions. So this is in regards to from Julie Frederick. This is in regards to grants for facade improvements to small businesses, if they are only in a qualified census tract or QCT. So what that means, and this is kind of getting into a little bit more of the weeds of the final rule itself. So what's the distinction between impacted, disproportionately impacted, or a business in a qualified census tract? The facade improvement question is a good one. It's likely that it would still be an eligible use for a disproportionately impacted business that doesn't reside necessarily within a qualified census tract. But that is another question that we can pass along to Treasury, since it is somewhat kind of specifically, it's separated in the final rule itself, but that's another one that we can check with Treasury on as well too. And I think in terms of, that's really kind of all the questions that we have in regards to the negative economic impacts section of the final rule. But if we weren't able to answer your question today, both the two that we highlighted that we will pass along to Treasury for a response. And then we can also follow up with you individually as well if we weren't able to get to your question today. But before we close out, Rachel, any sort of key highlights that you would like to provide for your section, or takeaway items?
Again, I think just the major takeaway is that there is really a wide range of services that you can provide to a population, so long as they are low or moderate income or meet some of those other, participation in federal assistance programs. And then there's an even broader range of services that you can apply to those who are low income or disproportionately impacted. And so, for those of you who are looking to invest these funds in supportive services to help residents recover, I think the final rule is a really welcome, flexible blueprint for how you can do that. But I'm always available to troubleshoot areas under this category, and I'm happy to continue answering questions in the future.
Great. Well, thank you, Rachel.
Thank you, Erin.
and thank you so much to everyone for joining us today. In closing, I also do want to make folks aware of our fourth information session that we will have this coming Friday, which is January 28th. That will be focused entirely around the public health response section within Treasury's final rule for the recovery fund. So again, that's this coming Friday, January 28th, and that will be at 2 p.m. Eastern as well. So would love for you all to join us for that session as well too. But thank you again, everyone, for joining us. Hope you all have a great rest of your week and take care.